So once we've gotten our receiver nice and tractioned out, ooh, that feels so good. How does that feel? Great. Oh man, I love this, right? Then we're gonna start working on the hams, our hamstrings. We're gonna lift up her leg at a 45-degree angle, okay? I like to use my outside leg because if I use my inside, oh, it's a little bit close to the groin. We don't want that. We don't want to slip. Some will be angry. I'm gonna use my outside leg. Got her knee, 45 or 90-degree angle. I'm gonna take the flat part of my foot just below the knee, just below that popliteal fossa. We don't want to cause a blood clot, right? We're gonna press in, see? I'm gonna hook up around her ankle and just lean back. Do you see how her femur is kind of bowing a little bit? Sometimes your client's leg will almost look like it's bending. Hmm?
It's so good.
Oh yeah.
What?
Sorry.
So good. No worries, love, you're in there.
Okay, awesome. The back of the knee or the back of the leg can be really sensitive. There's a lot of pressure. Because what I'm doing is I'm extending my leg. See how I'm all nice and straight, hooked in there? Got her ankle. I'm grabbing and just leaning back. I'm not pulling. Pulling, that's hard. That's gonna hurt my shoulders. Hooked in, leaning back.
Something else.
Right? You can do it gentle. Yeah. Oh, so once a lot of pressure, I'm gonna lean.
She does.
I'm gonna lean. Get that nice movement. I'm a big fan of gentle rocking. That's what I do in my practice. You guys can do it if you want. Right? And then come back in, right down. We're gonna start moving down. Do you see how now I'm in the nice big belly of those hams? Just pressing in. Now here I can use more of my heel if I want, or I can use more of the flat part of my foot, or more of the ball, just depending on how your client or your receiver wants. But we're gonna use flat foot right here. Press in and lean back, just like that. Now, some people may have issues with their ankles because this is a big handle that we're holding on. We're just gonna come up, grab the calf. Not as great. We still get that. We protect the ankle. Does that make sense? Oh, so can handle it? So I'm gonna do it. Lean back. See how my arms are extended? Okay. Sometimes I might need to get closer. Just lean. Now, as we move down the thigh, when we get here, it's gonna start slipping. We don't really wanna do that, So when we get to right about mid, lean in, you'll start feeling it. You're gonna get less pressure, right? And then we're gonna back off. Then once we do this, we're gonna open up the leg, just like that. And move back and hook her in. I'll do that again.
You better lift it because I didn't have nothing.
You're fine, babe. So lean and pull back.
Oh, so good.
And you'll see my toes are out. If I do this, this is uncomfortable. My leg is weird. Yep. My knees or my toes are digging in her knee. That's not fun. We don't want to slip and hit anything. We're going to go out. So push in and a little bit out and lean back. Just like that.
Did I do this to you the other day? Was it calming? It might have been. Yeah.
Just like that.
I didn't do anything.
See that nice big foot? So then once we're ready to transition, we're going to take our foot and flip it and turn it in and jam it. Oh, come back here. Okay, babe. Right up underneath that knee. Slowly bringing your client down like this. And you see how I've got her leg trapped? And now it's here. Now I can do more stuff. So once she's here, I've got her leg. I'm going to work all of these inner thighs. And again, closed. Not worrying about draping, not worried about accidental exposure. It's great. What's up? You okay? Okay. So I've got her leg here. I'm going to use nice, broad foot. Nice, broad bottom of my foot. Hook in, and I'm going to lean again. Right? Just like that. I'm going to lean again. You can also do this. This feels nice. Like a cat. Some people can't handle all this pressure. So I'm just going to be a cat. It feels nice. I can grab and pull just like this, right? As I get closer to her knee, I can feel that tension. I can feel those tendons. We're just gonna press in. Now I'm not using my arms. I'm not hunched over like, ugh. I've got her and just leaning back. Straight leg, pulling her onto my foot. Just like that. She's breathing. You okay? Wonderful.
So good.
You can just do this. When you start getting closer to the ground, just be careful. I don't want to accidentally slide in, cause any issues. Use this leg to support. There we go. How's that?
So good.
Good job.
I like the question.
Hmm?
It helps with consent and continual throughout a process that they're not used to.
Usually when we start going towards the more front of the hips, I tell my clients, I'm like, I'm going to work in this area. At any time you feel uncomfortable, just let me know and we'll change. You know, I'm going to work, I'm like, hey, I'm going to work the front of your hip. At any time you feel uncomfortable, just let me know and we'll stop. It's your session, no big deal. But with this, look how far away I am. I'm so far away that
you know where your hands are.
She knows exactly where my whole body is. I can't be creeping up on her while she's relaxing. And we're doing such needed work. So many people don't get inner thigh work done because we're all worried about getting reported. You know, but it needs it, we need it. I started with a personal trainer. My inner thighs need it. Very well aware of that. You know, so it's just lean and pull. Do cat. I like the cat kneading, it feels good. Lean and pull. You guys got that? All right. It's a little tricky when we do the fall over, but we'll help you out, okay? All right. There you go. So remember, after you've done traction, we're gonna go to the, yeah, of course. No, you're fine, honey. No, that's why we're here.
So we did that same move, but at the very end of going down the thighs, we go into ischial tuberosity and lean all the way back.
Kristen, why do you use that leg?
You can do that. That's totally fine. Sometimes, yeah, we can definitely do that because sometimes when you get on that ischial, you can slide and it just takes practice to get used with your feet. You're really good because you use your feet. So, but yeah, you definitely can. We can try it. Go for it.
Just like build the skill with it with somebody that you know before doing them on client.
Yeah, well, and the thing is too, you might have a client whose leg just fits beautifully to your foot. And you're like, oh, I can go all the way down. And you just check them out. Hey, how does that feel?
Yeah.
You like that? Do you feel that in your glutes? Awesome. They don't know that you're testing. They don't know that you're trying to figure it out. Does that make sense?
It's just, it's harder for them to switch to like using this leg once and as part of that flow.
How does that feel for you as the giver?
Just taking it slow.
Good job. How does that feel for you as the receiver? Good. Well, we want to come in a little bit higher. So come here, start here. You gotta get closer. Start her here. So you're gonna have to move your bottom closer.
Okay.
There you go, good job. Push her, straight. Now lean and pull, just like that. How does that feel?
Stretching my foot.
Yeah, is that a little bit better for you too?
A little better. It's hard to tell just yet. I hadn't really had a really deep analysis of her legs.
Okay. How does that feel for you?
Feels good.
Feels good?
You get that stretch and compression at the same time.
Just to about 50%, the half a leg. If you go lower towards the bottom, it starts to change the angle and leverage in a way. We're going to work this lower portion when we laterally rotate.
You doing okay? How you doing, Osa?
So good. I'm just feeling where it's resonating.
That's a good one, and a bad one, and a good one.
She's got the feet skill to do that, and it's something that you can practice. Totally fine.
I love it.
Yeah.
It's a
And
great
it's just because
spot.
of the way the
Yeah,
sequence
it is. Yeah,
It's not
like
wrong.
it was like ringing a lot of bells.
For the way the sequence is, it makes a little.
Does that feel good? Yeah. I usually hook a little bit more underneath because that's what feels good for me. And I don't usually, I grab the skin a little bit more. But again, you know, grab where you feel comfortable.
Like over there.
You know?
Great.
How does that feel for you?
It feels good. It
Good.
feels like I'm not in perfection.
Mostly what I would do is bring her leg up just a little bit more. Now lengthen your legs all the way. There you go. Now pull and lean back. How does that feel?
Better.
And then you can do your cat kneading. Right? Does that make sense? Okay. So when you want more pressure, you just lean back. You're not going to push.
That's quite remarkable, Kristen.
Okay.
It's like,
That make sense? Okay.
yeah. Are you feeling tension in there? It's not, it's just
I want
awareness.
to show you a
like,
different version of this, and I might not have heard what was going
It's
on
not even
here.
pinching.
I want to
it's just
change
like,
this a little bit.
How does that feel for you?
Feels okay. I feel kind of like I'm sliding around on the sheet.
Yeah, it's a vinyl mat with a sheet that says it's a little bit slidey. Like my mat is foam with a cotton thing, so it does not move. So it really depends. It's a little frustrating. If you want, just take your bottom off the sheet so you're just on this. Maybe a little bit better.
One second.
Yeah. Yeah, I usually wear cotton when I do Thai massage because those slidey fabrics, especially when you're on top of a client, just fall off. So we'll talk about this too at the business, but like these are Thai pants, which Robert is wearing, and they're cotton and they hold really well.
Oh, that's awesome.
Yeah,
I
of
want
course.
some.
They're like $20 on Amazon.
the clothes we talking about?
We'll talk about them during the business portion. Don't worry, babe.
I'm gonna try that again. Can you like monitor my posture?
Yeah, of course.
I'm doing this right.